Varicose veins are often a cosmetic concern for many people, but in some cases they may be a sign of bigger problems. These swollen or enlarged blood vessels are caused by a weakening in the veins wall or valves. Located deeper in the skin than spider veins, they may appear raised and often are blue. Varicose veins can be serious because they may be associated with the development of one or more of the following conditions: phlebitis, inflammation of the vein; thrombosis, this occurs when blood clots form in the enlarged vein; venous stasis ulcers, an ulcer is formed when there is not proper drainage in the enlarged vein. Although the exact causes for varicose and spider veins are unknown, pregnancy, heredity, prolonged standing, increased age, heavy lifting, and hormonal changes seem to be contributing factors. Dr. Charlie Hahn of Veins, Florida explains what varicose veins are and how they are treated.
We as humans, we are bipedal, we stand upright. So our body works against gravity. The gravity tends to pull blood down to the leg. And the human body is not designed for that. It's designed for being on four legs, and just like cows or horse. And so when you're standing up for a long time, the gravity will pull the blood down, and the body trying to prevent that by using a valve system in the veins. Over the years, the valves can worn out in the veins that cause varicose veins. People can live with varicose veins for a long time, and they tend to have a long-lasting effect on patients, more so than some of the medical problems, in which either you don't have symptoms or the symptom goes away after short treatment. But for varicose veins, it can come back years later, and it's been with patient for a long time. Genetic plays a very large role. Patients have a strong family history of varicose vein, tend to develop early, and tend to have lots more, and it certainly has a genetic disposition. Varicose veins can cause blood clots in them, and then they cause tremendous amount of pain once the blood in them become clots. And we call the thrombophlebitis. And also, the larger it gets, they tend to pull more blood, which cause skin changes, color changes around these large varicose veins. It can cause skin ulcers, which will take a very long time to heal. And also they can cause a large amount of bleeding if they got injured. For those large varicose veins, we make a tiny little incision and they use a special instrument to pull them out. And that can achieve a great success by removing the vein immediately. And those have minimal bleeding and minimal recovery time. Ablation process means we destroy the vein that has the valve problem. We can use different energy source, most popular laser, and also microwave. And these are minimal invasive. We place the device into the vein, which is usually the saphenous vein. They have leakage of the valve that causes those varicose veins. And when inside the vein, the device will heat up. It's either by microwave or by laser, and then will damage the lining of the varicose veins, and then will make it shrink and eventually go away. With ultrasound guidance, it's usually only about the 1 needle incision, and it has minimal blood loss and really minimal pain and post-operative recovery time.
You'll find contact information for Veins Florida under the Swollen Vein Story icon on our homepage at yourhometownhealth.com.